I'm Samantha Morton, and I'm a patient of Franciscan Health. My husband Trent and I live here in Indianapolis, and we're both avid runners. When I was out for one of my long runs, I experienced a tightness in my right hamstring that just wouldn't really relieve itself. Even with foam rolling and stretching and exercises, it was just really, really painful. And so after giving it some rest and going through some minor therapy, I decided that I needed to see a physician to determine what was going on. I found Franciscan Cityway because it's close to my home, and I read Dr. Reese's profile online that said that she specializes in treating athletes. And what I really liked about her information was that she said that she really strives to get athletes back to their normal and back into their sport.
PRP is something that we may try for a patient, but typically it's one of those things that we try after you've tried a lot of other different therapies. So what we do with PRP is you have an area in your body that has healed down abnormally. Let's use a tendon, for example. With a tendon, you have that abnormal area of scar. So what I'm gonna do is I'm going to recreate your injury so that your body can actually heal it down in a better way, in a more organized way. So then we take your blood, spin it down, and then while it's spinning down, I typically numb up the area. And then before the injection, what I'm gonna do is make a couple passes with a needle to try to stir up some blood flow to the area, and in effect, re-injuring that area of tendon. And then we'll inject that PRP as a healing shot.
After the PRP procedure, I was able to rest for a while, and then I started back with physical therapy in about 2 to 3 weeks. And then I started doing run and walk progression as well. And then I was back to running in about 2.5 months after the procedure.
And then that next 1 to 3 months is really where people start to notice the major difference. That's where the organization phase comes in. That's where your body really makes that tendon into a really good area. And typically around 3 months is when you have good benefit from PRP. People who had PRP injections had lasting benefit that was longer than gel injections or steroid injections. So people were getting about 9 to 12 months of benefit versus like 6 months to 12 months for the gel.
I'm really grateful for Dr. Reese's expertise and knowledge on treating me as an athlete. People who are interested in their sport really love what they're doing, and getting them back to that is the #1 priority.
To find a Franciscan Health sports medicine specialist near you, go to franciscanhealth.org/sportsmedicine.